All right. Future nurses, get ready for a deep dive that's going to throw you right into the thick of it, the ER.
Oh, yeah, emergency nursing.
We're going deep into a Unitech learning module, and this one covers some intense scenarios.
Intense, right.
Drug overdoses, alcohol intoxication.
Mm-hmm.
We're even getting into the realities of sexual assault and human trafficking.
You know what's fascinating to me about emergency nursing? It demands this unique blend of medical knowledge,
Right.
but also you have to have this sharp intuition.
Yeah.
You're not just treating symptoms. You're piecing together a puzzle with very limited information,
Right.
often under immense pressure.
Yeah, absolutely. Okay, so first up, let's talk drug overdoses.
Okay.
I mean, we're talking the whole spectrum here. Heroin, benzos, like Xanax, stimulants, cocaine, meth.
Yeah, yeah.
You'll even see overdoses from everyday meds like Tylenol.
Right.
If someone takes enough.
It's all about the dose.
It really is. What stands out to me is just the variety of substances.
Right, and that's why it's crucial to recognize the specific drug. It's not just about seeing someone in distress. It's about understanding how each substance uniquely affects the body. Take opioids, for instance.
Yeah.
They depress the respiratory system, leading to pinpoint pupils and dangerously slow breathing.
Oh, wow.
But with stimulants, you see the opposite.
Right.
Agitation, racing heart. You might even see seizures.
So as a nursing student in the ER, you're kind of playing detective, right?
Exactly.
Looking for those telltale signs to guide your treatment.
You got it. But beyond just recognizing symptoms, you need to know the antidotes.
The antidotes.
For opioid overdoses, naloxone, that's your go-to.
Yeah.
A true lifesaver. It literally reverses the effects of the opioid.
That's amazing.
And naloxone comes in a lot of different forms these days.
I didn't know that.
From nasal sprays to auto-injectors, knowing your options. Knowing the pros and cons of each, that's essential in the ER.
It's amazing how quickly an antidote can bring someone back from the brink. It's like pharmacology in action right there at the bedside.
It is powerful stuff, but it's not always straightforward. Sometimes you need to physically remove the toxin from the body.
Okay, how do you do that?
So think gastric lavage.
Gastric lavage.
You're essentially pumping the stomach or using activated charcoal to bind to the drug and prevent absorption.
I remember learning about those procedures in class, but it's different imagining them in a real ER setting.
Oh, yeah.
What kind of complications could even arise during those procedures?
Well, with gastric lavage, there's always a risk of aspiration.
Right.
That's when stomach contents get into the lungs.
Oh, gosh.
Which can be life-threatening.
Wow.
And activated charcoal. It's not a magic bullet.
Right.
It doesn't work for all drugs, and it can interfere with other medications the patient might need.
So even with those interventions, ongoing monitoring is key, right?
Absolutely. A patient's condition can change so quickly, especially in overdose situations.
Yeah.
You're constantly reassessing, adjusting your care plan based on those subtle shifts.
It's a lot to keep track of. Okay, let's shift gears to another familiar sight in the ER, especially on a Friday night.
Oh, yeah. I know where you're going with this.
Alcohol intoxication.
Yep.
As nursing students, we've all seen our fair share of patients who've had a little too much.
A few too many.
But how do you, as an experienced ER nurse, differentiate between someone who just needs to sleep it off and someone who's in real danger?
That is a critical skill for any ER nurse.
Yeah.
So mild to moderate intoxication might show up as slurred speech, clumsiness, maybe some confusion, those classic drunk behaviors.
Right, right.
But severe intoxication.
Okay.
That's when you start seeing those concerning symptoms.
Right.
Breathing problems, loss of consciousness, even slipping into a coma. That's when you know it's gone way beyond just a fun night out.
It's a stark reminder that alcohol, even though it's socially accepted, can be so dangerous.
Yeah.
It's not just someone acting silly. It's about potential damage to their body.
Exactly. And as a nurse, you're not just babysitting someone until they sober up. You're preventing aspiration, monitoring their blood sugar, which can drop dangerously low with excessive alcohol intake.
Wow.
And sometimes even needing to sedate them for everyone's safety.
That's something I hadn't considered, the need for sedation. Why would you sedate someone who's already intoxicated?
Well, think about it. Someone who's severely intoxicated can be unpredictable and even violent.
Oh, right.
Sedation might be necessary to protect them from harming themselves or others.
Okay.
And it allows you to provide essential medical care. It's not a decision you take lightly, but sometimes it's the safest course of action.
Wow. Yeah, I see what you mean. And let's not forget about the legal and ethical considerations here, especially if the patient is a minor.
Oh, absolutely. Treating a minor for alcohol intoxication, that opens up a whole other layer of complexity.
Yeah.
You have to consider things like parental consent, confidentiality laws, mandatory reporting requirements. It's a lot to juggle.
Right.
And it really highlights the need for nurses to be well versed in both the medical and the legal aspects of their practice.
It's a lot.
Yeah.
Okay, let's shift gears now to a topic that's undeniably tough, but so crucial for ER nurses to be prepared for sexual assault.
Yeah.
We're not just talking about treating physical injuries. We're talking about providing care that acknowledges the immense trauma
Right.
that someone has just experienced.
Absolutely. For nursing students, understanding the emotional and psychological impact of sexual assault.
Right.
That's as vital as knowing the medical procedures.
Yeah.
You're not just treating a patient, you're supporting a survivor through one of the most vulnerable moments in their life.
Right.
That means creating a safe and supportive environment from the second they step into the ER.
It's about recognizing that this is a person who's just had their sense of safety and control shattered. How do you, as an experienced ER nurse, approach a patient in that situation?
Well, it starts with clear communication, explaining every step of the exam and giving the patient choices whenever possible.
Okay.
Remember, you're collecting forensic evidence with a sexual assault kit,
Right.
which can feel very invasive and even re-traumatizing. So it's about empowering the patient
Okay.
by giving them back a sense of agency, even in this incredibly difficult situation.
And you mentioned forensic evidence. Can you break down exactly what that means and why it's so important in these cases?
Sure, forensic evidence is any physical evidence that could be used in a legal investigation.
Okay.
In a sexual assault case, that
Yeah.
could include things like clothing fibers, hair samples, or bodily fluids.
Got it.
The sexual assault kit is a standardized way of collecting and preserving this evidence.
Right.
And it's essential for holding perpetrators accountable. As nurses, we play a critical role in ensuring that this evidence is collected correctly and documented meticulously.
It's like you're a detective, a caregiver, and an advocate all rolled into one.
Exactly. And it doesn't stop there. The care you provide extends far beyond that initial ER visit.
So we're talking about STI and pregnancy prevention.
That's part of it, yes, but it's also about connecting the patient to long-term support, counseling support groups, legal aid. This is where your understanding of community resources and your ability to advocate for your patient become incredibly important.
What are some of the challenges you see survivors facing when it comes to accessing those resources?
Well, survivors often face barriers like stigma, fear of not being believed, lack of transportation, or even financial constraints that prevent them from getting the help they need.
Right. It makes sense.
And as nurses, we can help bridge those gaps by providing information resources and even just a listening ear.
Yeah.
Sometimes just knowing that someone believes them and is there to support them can make a world of difference.
Now, on to a topic that might surprise some nursing students, human trafficking.
Yeah.
It's not something you necessarily think of as an ER issue, but as we're learning, it's more prevalent than we realize, and nurses are often on the front lines of identifying it.
What's often misunderstood about human trafficking is that it's not always as dramatic as it's portrayed in movies.
Okay.
It's not always about kidnappings or chains.
Right.
It's often much more subtle, using coercion manipulation or even threats to control someone.
Wow. It can happen to anyone, regardless of age, gender, or background.
Right.
But traffickers often prey on people who are vulnerable,
Okay.
those experiencing homelessness, poverty, or substance abuse.
So what are the red flags that ER nurses should be looking out for? We talked about unexplained injuries, someone being overly controlling, inconsistencies in their story, but are there any other signs, maybe more subtle ones, that could indicate trafficking?
You're on the right track.
Right.
Those are all important clues, but also pay attention to things like branding tattoos, malnutrition, or signs of physical or psychological abuse.
Okay.
Is the patient hesitant to make eye contact? Do they seem fearful or anxious, especially when talking about their home life or their companion? These are all subtle cues that something might be wrong.
And I imagine communication is key here, especially given the power dynamics at play. How do you, as an experienced nurse, approach a patient you suspect might be a victim of trafficking?
Well, the first step is to try to get the patient alone, away from the person who might be controlling them.
Even a few minutes of private conversation can make a world of difference.
Wow.
Start by building rapport, letting them know you're there to help ask open-ended questions like, do you feel safe at home? Or, is anyone forcing you to do things you don't want to do?
It's about creating a safe space where they feel empowered to speak up, even if they're terrified.
Exactly. And remember, you're not expected to be a human trafficking expert. Your role is to recognize the signs and activate the appropriate resources.
Right.
That might involve contacting social work, law enforcement, or a human trafficking hotline. You're the link to a whole network of support.
And that connection you make could literally be the difference between someone staying trapped and finding their way to freedom.
Yeah.
That's a pretty powerful realization for a nursing student, knowing that they could have that kind of impact.
Wow, we've covered some really heavy stuff today. Overdoses, intoxications, sexual assault, human trafficking.
It is a lot.
It's a lot to process, even for seasoned nurses, let alone those just starting out.
Yeah, it is. And it really highlights the incredible responsibility that comes with being an ER nurse. Yeah.
But amidst all these intense scenarios, there's a common thread that I find particularly fascinating.
Oh, I'm curious. What's that?
It's the issue of power imbalances.
Power imbalances. Okay.
Think about it. Addiction is often fueled by poverty, lack of access to healthcare, maybe even past trauma.
Mm-hmm.
Alcohol intoxication, like we discussed, can be a way of coping with stress or pain or underlying mental health issues that aren't being addressed.
And sexual assault and human trafficking are all about someone exploiting their power over another person.
Exactly. And this is where ER nurses have a unique opportunity to not just treat the immediate crisis,
Right.
but to advocate for systemic change.
I like that.
You're in a position to see these patterns, these societal cracks that lead to these emergencies.
So it's not just about patching people up and sending them back out into the same broken system.
Right. You're treating the symptoms, but you're also witnessing the root causes.
Yeah.
Your observations, your voice can be incredibly powerful in pushing for policies and programs that create a safer, healthier community. I love that perspective. It's like, you're not just a nurse. You're a social detective uncovering the hidden factors that contribute to these emergencies.
That's a great way to put it. And for all you nursing students listening, this is what I want you to take away from this deep dive emergency nursing is demanding. It's intense, but it's also incredibly rewarding. You're on the front lines, making a real difference in people's lives every single shift.
And as we've seen, it's not just about the medical skills.
Right.
It's about empathy, critical thinking, and being that advocate for those who might not have a voice.
Exactly. Remember, you don't need to have all the answers right away. What's important is to have the compassion, the willingness to learn, and the courage to speak up for what's right.
We've thrown a lot at you today, future nurses, but as you step into the ER, remember this. You are not alone. You have a whole team supporting you. Nurses, doctors, social workers, everyone working together.
And trust your instincts sometimes. That gut feeling that something's not quite right is the first step towards making a huge difference in someone's life.
So to all the future ER nurses out there, keep learning, keep asking questions, and keep that fire for helping others burning bright. You've got this, and that wraps up our deep dive into the world of emergency nursing. Until next time, stay curious and stay compassionate.